I'm back to report on how my first week after surgery went after my Goldilocks mastectomy, and I also had a small revision on my left side here from my first mastectomy. I'm having a really smooth recovery this time, and I realize it's frustrating to watch videos like this where people are having smooth recoveries if you're not. So just so you know, I realize everyone is super unique in their recoverability. We all have different strengths and weaknesses all over the board in many, many different ways. So this is just one story. Hopefully it's helpful and encouraging to you. I had these really different and new kinds of bandages on, and I'll show you a little picture here of what they looked like when they were still on right after surgery. It turns out they started to kind of peel off, and the outer edges were just like Tegaderm or like a real thin see-through kind of plastic Band-Aid material. And they started to peel off, and so I knew that I needed to take them off before my real first intensive shower on day 3. And so I started taking them off, but to my surprise, the inner part, which was a thick bandage, it was kind of a grayish color, kind of a purplish gray, and it was actually really sticky. It was very absorbent, really thick, but also very sticky, and I wasn't expecting it to be sticky in the middle. And so they were really hard to peel off, and I did take some video of my removing them, but I won't show you because my video turned out really blurry, and my face was also just like really making contortions because I was really worried I would pull off the steri strips underneath that were across my incisions. And so I was very anxious during that process, and so I won't share with you that super anxious process that I went through. But it was interesting to me that those bandages were super sticky all the way through, and so I just had to peel them off very, very slowly. And thankfully they did not pull any of my steri strips off. I think my steri strips are actually still pretty plastered on because there's just a lot of blood and fluids that dried on and keep them there until I take a couple more showers probably at this point. So still got the steri strips, but the bandages that were on top of them came off. And actually especially when I removed the one that was under my Goldilocks side, and just so you know really quickly, Goldilocks just means that they preserve your skin and fold it up under and cover it over with your skin to make a little bit of a breast mound as much as they can with what skin you have. So that's what I had done over here on the right. I did not have that done. I'm very flat on the left. Over on the right, I was surprised when this lower bandage came off that was kind of hiding the inframammary fold, this shelf that you usually have under your breast that creates kind of a crease. I was surprised to see that there's quite a fold there, quite a shelf, and there is cleavage there that I did not expect to see. And that was pretty surprising because I was expecting to be almost flat and to have the skin just provide some padding so that I wasn't concave, which I am on this side. And I'll show you at the end of the video what I look like if you want to stay tuned and see some of the graphic details. It is totally legal to share my skin after mastectomy, just in case you're wondering, but if you don't want to stay that long and see it, I don't blame you. That'll come way later in this video. I did have a drain, as most people do after mastectomy. It's very common to have at least one drain, and I had, thankfully, just 5 days, and probably could have done with much less with my drain. And since I live in the outer Portland area, in the rural area outside of Portland, Oregon, and I had my surgery up in Seattle, I couldn't go up to Seattle when my drain fluids got low enough, the output got low enough each day, and really it was the second day after surgery that they were low enough to remove the drain. So I kept it for a few days after that. It was interesting to see what happened to the fluid, how it changed. It went from kind of a bright red color to a very light pinkish orange, watered down kind of juicy color, and I showed that in my last video. And finally, the last color was like a dark yellow color. It was like the color of really, really strong or concentrated urine. And that was surprising. I hadn't let my drain in the past go that far to see that kind of color change and to see that yellow color. And I don't have a picture of that. I didn't capture that, but that was a sign to me that I was done draining and it was about to dry up. So I went to a local just kind of immediate care center, urgent care center. And I actually called around to many urgent care centers and asked them if they would remove my drain. And many of them said no, but one of them here locally said yes. And I got a note from my surgeon up in Seattle so that they knew they had permission from my surgeon to do this, that my levels were low enough. And I just went in and really quickly got in. I had an appointment at the immediate care center, so that was nice. And they just pulled my drain out. It's pretty simple to pull a drain out. It's always a huge relief to get your drain out. Everybody knows who's been through it. It's really the biggest hassle in mastectomy or any surgery is to have a drain hanging off of your body. And that drain can become just really, really sore where it goes in and where it kind of is laying underneath your skin, which for me was just right down here underneath my right breast. So big relief that I got that out after just 5 days after surgery. A lot of people take at least a week, sometimes 2 weeks to have to live with that. And I can't imagine living with it for 2 weeks. I'm so glad that both times I've had drains, I've had them out within a week. So here's hoping you do too if you're having surgery soon. So one of the more concerning things for me right after I took those big bandages off was that I noticed that the right side of my right breast was quite red and felt hot to the touch. So there was a lot of inflammation going on this outer side of my breast, and that really worried me and made me wonder if there was an infection. I didn't call or take pictures or send pictures out to anyone because it wasn't quite red enough for me to think that it was infected, and it didn't feel really sore or painful. It just felt warm to the touch. So there was definitely some inflammation going on in there, and it definitely toned down day by day. And by the time I had my drain out and saw a doctor who could actually look at it and assess it, she wasn't concerned. And then just 2 days later, I did go up on the train to Seattle at the 7-day point and got assessed by my actual plastic surgeon, and she wasn't concerned either. And by then the swelling, the hotness, and the redness had really, really reduced, so it didn't look very concerning to anyone at that point. So I think it's pretty natural to have a little bit of redness, pinkness, I guess I would say, not redness, but just pinkness, and a little bit of hotness to the touch. My plastic surgeon informed me that infection actually usually comes later than 1 week, so it was actually even too soon to know if there was infection inside the breast. So we'll know, at the 2-week point or 1.5 week point whether that's happening. But I wasn't aware of that because I never had an infection in my first mastectomy. And so that was news to me, and I thought I would share it so that you know too that right away isn't the time that you're watching for an infection. When you take the drain out, you watch for seroma, which is an extra lump that would just be a lump full of fluid that they might have to drain at some point. There's none of that either for me, so I'm doing pretty well. The concept of compression has been a really confusing one for me, and throughout my whole mastectomy journey, I've heard different people give different advice. Certainly here on YouTube, people are giving lots of different kinds of advice about how much compression you need after mastectomy, and I think for different procedures it's different. So if you were totally flat, you could have plenty of compression and it wouldn't change your outcome at all. But because I'm not totally flat, on this side at least, I am hoping to have a breast-shaped breast. And so I started out with some ACE bandaging because it actually made me feel a little more secure with moving around and a little bit more kind of invincible to the pain, just because that really held me in place and really secure and tight. But I learned shortly after that that might not be such a good idea for my procedure, my Goldilocks mastectomy, because it really, an ACE bandage especially, just really pushes flat on your chest and it kind of pushes it down, and it's already a little flat to start out with. It would benefit from being a little rounder. And so I haven't used an ACE bandage since that first couple of days. And so my compression plan is just to wear a really light compression garment, or shapewear is kind of what it's called, that is evenly compressing all around in a round shape. So not compressing just in one direction like an ACE bandage would, but all the way around in a kind of a globe or sphere shape around my breast. So right now what that looks like is I have just a very light compression elastic camisole here under my clothing. And you can also get shapewear or bras that are particularly more spandexy, that are particularly meant for compression. But for me right now, this is doing the trick pretty nicely. You can also just use the bra that they send you home with, the one that's got the Velcro closure and the little loop to hold your drain. That's pretty well evenly compressing and in a round kind of motion also. I think it does have a little bit too much pressure in this inward direction, so I'm not using that myself. This one that I've got on is pretty comfortable, and it's a light compression, so it's even, but it's not too intense. So I like this as the option for now. If you're really concerned about the shape that your breast is being forced into by your compression garment, then you just should probably invest in something called shapewear, which you mostly can find online. There are some retail shops that have shapewear, but like in Portland, there's one that specializes in shapewear, and it's actually mostly Latino run and very little staff that speak English, I found. So when I went there, I couldn't get a lot of help because they couldn't speak English and I couldn't speak Spanish. So probably best to do your research and get your physical therapist input maybe, and then find something online that seems suited to you. I'll also put my favorite YouTuber physical therapist for post-mastectomy down in the show notes so that you can see what she has to say about shapewear. She's got a couple good videos about it. One thing that you might have been waiting to hear from me about is how my THC and CBD plan has worked out, and it's been quite different than I expected. My plan was to replace Tylenol with my THC and CBD pain combination. So I have a serum or a tincture that's based in coconut oil that has mostly CBD and a touch of THC, so kind of like microdosing for pain, and also for brain inflammation, for recovery, for myself, recovery after anesthesia. I was hoping and planning to use that a lot more often than I have. My pain has not been such that I've needed anything beyond gabapentin for this whole first week, or 10 days actually at this point. I haven't been able to titrate down as quickly as I wanted to from the gabapentin. I'm still holding strong at 200 milligrams every 6 hours. My plan was to supplement that with a little THC in between every 6 hours at the 3-hour point in between the gabapentin, and I just haven't needed to do that. My pain level hasn't been high enough. So it's much, much better in terms of pain levels than my first mastectomy was. I haven't needed any Tylenol at all, and certainly no opiates at all since my surgery day. So what I have done that surprised me though is that I wanted some help with sleep, and so I'm using a more of a sleep blend of THC and CBD together, and again it's mostly CBD. So this is a different bottle of CBD or cannabinoids than what I've shown in my other videos. The bright green one was the one I expected to use most, but this one, Hibernate, is the one that I'm turning out to use more of. And again, this is just a local Oregon brand. It's not something you can find outside of Oregon or California. It is carried, they do carry it in some shops in California, but what it is it is mostly CBD, and it's got THC, so 15 parts CBD, 5 parts THC, and then a sleepy cannabinoid called CBN, just 2.5 parts of that. So very micro doses of THC, very small. I only use a few drops of this to go to sleep at night, so not a whole lot. It's not a strong dose, and you definitely don't get high from the THC. The CBD counteracts that and makes your sleepiness even more potent, and the tendency for the psychoactive effects much lower. So that's been my CBD and THC plan. Kind of a little different than I expected, as most things are in life, but I'm really glad that I had both blends handy for when I need them. And that bright green peak daytime THC and CBD blend, I have used it like every 3rd day, because it has some components that are really good for brain inflammation. And so I do use it a little bit, but not very much, because I don't want to feel quite as tired and woozy as it sometimes makes me feel on days that I'm most active. So I use it on the days that I'm more restful and still and just staying at home. I did travel all by myself to Seattle back to see my surgeon for my post-op, just at the 7-day point, so just 1 week after surgery. I was feeling pretty strong, and I was tired, so I slept a lot on the train on the way there. But when I got there, I had a lot of energy, and took a lift to the hospital, and my surgeon, my plastic surgeon, was very pleased with how I was doing. She thought that the breast mound looked great. It didn't feel like there was a lot of swelling. She was totally fine with the drain being gone. She had approved that personally, so she wasn't surprised to see that. But she thought it looked really, really good, and she encouraged me to just leave the steri strips on until they naturally started coming off in the shower with water. She was really surprised that I had no bruising at all, and I think that's due to the arnica oil mixture that I have in my CBD sports gel that I showed you in my last video. It's also from Ojai Energetics, and it is definitely free for purchasing all across the U.S. It's just CBD. There's no THC in that one. So if you're interested in reducing your bruising after surgery, I started applying that wherever I could around the bandages just right away after surgery, and I still apply it every day around the steri strips just to keep the bruising and the soreness and pain locally down. So that's a really good trick too. One thing that was kind of disappointing in my surgery is I talked to the anesthesiologist and told him I didn't want any inhalants. So my preference is just to stay away from inhalants as much as possible in surgery, and he couldn't promise me that he wouldn't use it, and I still don't know if he had or not used those. And there are lots and lots of synthetic chemical drugs that they put into you as part of your anesthesia cocktail, and a lot of them are really hard on the brain, hard on the body, hard to detox. So I have been taking chlorella as a supplement daily ever since my surgery, and I continue to take that. Chlorella pills are usually compacted little green pills, and I usually take like a handful of them, like 5 or 10 at a time. And I take them between meals and not with my other supplements, because they're meant to kind of grab onto molecules and toxins and pull them out of the body. So you don't want them to grab onto the good stuff like your supplements and pull those out of your body just accidentally. So I always take them apart from my supplements. My favorite brand of chlorella right now is this one. It's from Dr. Mercola. So finally, I'm just having a lot less stiffness and a lot more ability to move my arms around. My soreness on the left side, because it was just a little revision, they just took the lump off that was there, was pretty minimal, so I don't have much soreness at all. I have a lot of flexibility on the left, but on the right, I still can't raise my hand very high, and I don't push it. I'm not throwing the ball for my dog on the right side like I normally do. I always use my left hand to throw things. And so I'm just really gently stretching at this point. I'm not allowed to see my physical therapist for a whole month after surgery, so I kind of have to do real gentle, mild stretching for now. And I'm at the point where I will go ahead and show you what my steri strips look like. So if you want to tune out, feel free to tune out. But my revision is on this side, and I still have a steri strip just going one straight across here. And it looks like that. It's not even sore to the touch, and I haven't had any bruising at all on this side. This side has a lot more steri strips, and with it being summer, I have to really watch that I don't have a lot of sweat collecting down here at the bottom of my Goldilocks mastectomy, because there's a long steri strip that goes all along the bottom, and then one that goes down the middle as well in an anchor pattern, as is the typical pattern for most mastectomies these days. So it's actually okay. Doesn't feel too painful to the touch. Actually, my most painful part is just under my arm at the top of my rib cage for some reason, probably because that's where the drain was. Probably just really sensitive there, recovering from my drain. But the steri strips and the incisions themselves are not too sensitive. Of course, I am still on the nerve pain gabapentin medication, so I'm sure that helps a lot. They'd probably be a little bit more sore to the touch if I wasn't taking gabapentin. Gabapentin also helps a lot with that iron chest pressurized feeling, so I really like it. It's definitely my pharmaceutical of choice for after mastectomy. And that's everything I have to share for week 1. My progress in recovery is going great, so thanks for your thoughts and prayers, and I will see you in my next video giving you another update like this one. See you then. Bye-bye.